Hi, I'm Ed Annand, an equine veterinarian of 10 years' experience and a scientist studying emerging infectious disease, including Hendra virus. Zoonoses is the term that we use for a disease which can be transmitted to humans from animals. It comes from the late 19th century, Greek in origin, the term zoo meaning animals and nosis for disease. 70% of emerging human infections are zoonotic, that is, they've come from animals. And the majority of these have a wildlife origin, but often the spillover to humans comes via domestic animals. Examples include Ebola virus, SARS, avian influenza, and Hendra virus. These illnesses have a huge human life and financial cost on society. Estimates include $6 billion US for Ebola or $7 trillion for avian influenza. As veterinarians, we're on the front line of exposure to these diseases. Around half of Australian veterinarians reported having contracted a zoonotic disease in studies done by colleagues of mine from the University of Sydney. The risk of equine vets contracting methicillin-resistant Staph aureus, a multi-resistant bacterial infection, is 23 times higher than the public. Due to our close contact with diseased animals, it's appreciated that vets are at a higher risk of contracting a zoonotic illness. The zoonotic disease that this jury is focusing on is Hendra virus. As you've heard, it first occurred in 1994 in a racing stable in Hendra. My colleague and friend, highly experienced and dedicated veterinarian Dr. Peter Reid, attended the scene. There were 7 horses that died in just 12 hours. Horses appeared to drown in their own lung fluids. There were 13 horses that died of the acute illness and 7 horses that were subsequently euthanized. The outbreak resulted in the death of the horse trainer. The strapper of the stable became sick but recovered. The emergence of this disease had a huge industry impact. Brisbane racing was cancelled for 3 weeks and there was $6 million in losses. There was no movement of horses permitted in the surrounding areas. A great deal of research followed the outbreak in Hendra, and at the Australian Animal Health Laboratory in Geelong, CSIRO, seen in the image on the left, a novel virus was isolated. It was initially given the name equine morbillivirus, and 1 year later, the link was made to it having come from flying foxes. Other viruses that have been linked to coming from bats include Ebola virus, Middle Eastern Respiratory Syndrome virus, SARS, and Nipah virus. Also 1 year later, there was another fatality due to Hendra virus, another human fatality. This time it was the husband of a veterinarian who'd assisted in the post-mortem of a sick horse. That horse had died from Hendra virus 1 year earlier and about a month earlier than the outbreak in Hendra. The man initially became sick but recovered, only to succumb to encephalitis and pass away in 1995. Further research, including at the Australian Animal Health Laboratory, has identified evidence of Hendra virus being present in all 4 species of Pteropus fruit bats that are found on mainland Australia. And the distribution of potential spillover is extends as far south as South Australia, where in January 2013, Hendra virus genetic material was detected in flying fox urine. Ever since the link to bats was made, advice has been given to horse owners to cover, feed, and water, to keep horses stabled at night, and avoid excessive access to pastures that have flowering trees or fruit trees. But despite this advice, spillovers have continued to occur. 58 further outbreaks, in fact, since '94, with 4 so far this year. Horses continue to die painfully and unnecessary given that there is an effective vaccine. This is both a biosecurity and a horse welfare issue. Whether it be that many horse owners have not effectively heeded or been able to act on the advice, or whether it be that these measures are insufficient in protecting against Hendra virus spillover, we're not sure. But we do know that cases continue to occur, and many without perceivable proximity to flying foxes or flowering fruit trees. So what do we look for as horse vets? Well, Hendra virus has very non-specific clinical signs and very subtle early signs. The disease can mimic many other horse illnesses. And horses may be infectious, that is, they may transmit the virus prior to showing any clinical signs. If we were to attempt to describe Hendra virus, we say that it's an acute, severe, and often rapidly progressing fatal illness, usually featuring a fever with respiratory and/or neurological signs. Even once symptoms progress and become severe, differentiating the cause of acutely ill horses can be very challenging. For example, determining if a 500 kilogram horse is unstable on its feet and dropping to the ground due to abdominal pain, termed colic, or neurological deficits, or a combination, can be difficult. Differentiating, of course, these symptoms is not always helpful anyway, given that many diseases share clinical presentations. The boxes in the center of this slide are taken from a recent publication that I, myself and others, placed in the Northern Territory CDC Bulletin. It highlights the range of diagnoses that could be attributable to horses showing Hendra-like illnesses and some of the challenges faced by veterinarians in attending and diagnosing these conditions. It also highlights that some of the differential or alternative diagnoses for horses with these symptoms may as well be potentially zoonotic illnesses, other infectious diseases that could transmit to people. Tragically, further human lives have been lost. In 2008, the outbreak of Hendra virus at a clinic in Redlands resulted in the death of a veterinarian. One of the clinic's nursing staff also became severely ill, although she has recovered. Her illness was prolonged. The following year, another veterinarian lost his life due to this virus from North Queensland. The Hendra virus horse vaccine was developed as a One Health approach to preventing this zoonosis. Its development involved rigorous testing and an international collaboration, and has received both international and Australian scientific accolades. The vaccine is a subunit vaccine, comprising only of the outer G glycoprotein of the virus, and as such there's no risk that horses that receive the vaccine will develop Hendra virus infection as a result of this. In the trials that were performed on this vaccine, it proved 100% effective in preventing Hendra virus in horses that were vaccinated upon challenge with the virus. One of the early landmarks was in 2005, when the G-glycoprotein was recognized as a potential immunogen by Professor Chris Broder in the United States. It took then until 2012 until we had a vaccine that was approved via a minor use permit for use in Australian horses. Full registration was approved by the APVMA in 2015, and in May 2016 the vaccine received approval for 12-month boosters after the initial 3-dose. There's been great uptake of the equine Hendra virus vaccine. Since its release in 2012, over 500,000 doses have been administered. As is depicted in this map, horses have been vaccinated in every state and territory across Australia. Despite this, there still remain high numbers of horses in Hendra virus endemic areas that do not receive the vaccine. For these horses, there are very serious health risks. Many of these horses will be denied appropriate and timely veterinary treatment on the occasion that they fall ill. The delays are in place until the Hendra virus can be excluded. Hendra virus exclusion occurs via testing at the state laboratory, and there can be delays of up to 3 days in this testing, despite every effort being made for it to occur as quickly as possible. Some horses will die of conditions that could otherwise be preventable in this time, and this has insurance implications. So what is the resistance to the vaccine amongst some horse owners? Well, I draw links and contrast here to the situation in the UK where I've practiced previously. In Australia, horse owners have not been used to any vaccine being restricted to veterinary administration, whereas in the UK, the equine influenza vaccine is administered only by vets. The reason why the Hendra virus vaccine administration is restricted to vets is due to the seriousness of the transmission risk of this disease to staff and horse handlers. But of course, it does entail additional costs for horse owners, and so cost is one of the reasons that's been listed as driving the resistance amongst some. Another reason are perceptions around horse reactions to the vaccine. I would draw here similarities to the human measles, mumps, rubella vaccine polarised debate. Similarly, we're seeing a deterioration and standoff between minority groups of horse owners and veterinarians and scientists. A lot of misinformation is often involved in driving the arguments in this debate. This table outlines the Hendra virus spillover events in horses, as well as exposure, illnesses and fatalities in humans. You'll notice there's been 60 spillover events in horses, resulting in 102 horse fatalities. Prior to 2006, Hendra virus was considered sporadic, occurring around every 5 years and isolated. Subsequent to that time, Hendra virus has occurred every single year and with increasing numbers of horses affected. There was 18 separate Hendra virus spillover events affecting 23 horses in 2011, that being an extraordinary year. But in general, there is an increasing and spillover of Hendra virus. You've heard other presentations as part of this jury which offer the explanation of ecological pressures on bats and the changes around their behaviours, migratory behaviours, and the situation that we now have where large bat colonies are living permanently in big cities in close association with humans and horses. Alongside these continued spillover events, we're seeing continued human exposure to the virus. The numbers in pale blue on this table to the right indicate those humans that have received monoclonal antibody therapy. This treatment is an emergency treatment that's still under experimental trial. You'll notice that 3 humans received monoclonal antibody treatment this year. The producers of the monoclonal antibody, Professor Chris Broder, has said recently that he finds it surprising and somewhat disappointing that even children are receiving an emergency life-saving drug as part of an experimental trial when a horse vaccine has been available for 3 years that could have prevented their life-threatening viral exposures. "2016 saw a world-first parliamentary inquiry into a vaccination, the Hendra virus horse vaccine. As part of this, there were 293 submissions. This included from horse owners, industry groups, the APVMA, Zoetis, and the Australian Veterinary Association, as well as government departments. The Queensland Parliament's recommendations were released in April 2017 and included a reminder that Hendra virus vaccine is considered the single most effective way of reducing the risk of Hendra virus infection in horses. They recommended that owners discuss vaccination with their veterinarian and suggested that event organisers might require vaccination as a condition for participation as part of their biosecurity plan. The parliamentary's recommendations did not endorse mandatory vaccination for horses. So what happens when a horse presents with an acute illness and hasn't been vaccinated? Here I'd like to give you an idea of the obligations that are placed on vets and other first responders to unvaccinated animals and their owners. In such instances, vets are obliged to follow strict and extensive guidelines on the handling of potential Hendra virus infections in horses that include guidelines on biosecurity practices, the application of personal protective equipment designed to protect both the veterinarian and the horse owners from the potentially fatal exposure. Samples are collected, including a nasal, oral and rectal mucosal swab and blood, and sent to the state laboratory. As mentioned earlier, these testing can involve delays of up to 3 days, which can have very serious implications. Personal protective equipment can be restrictive and make the already dangerous job of handling horses more dangerous. In addition to the challenges already highlighted, veterinarians attending horses displaying Hendra-like symptoms have to negotiate significant workplace health and safety implications. This was highlighted when 3 veterinarians were prosecuted by workplace health and safety. Most of the allegations related to insufficient PPE and biosecurity practices, including issues relating to the horses and their owners. The approach taken by these prosecuted veterinarians included what would normally be considered reasonable and commonplace in the extraordinary challenges faced by vets dealing with acutely ill Hendra horses. it's, it's probably worthwhile considering some of the specifics of these charges. One vet was charged with having inserted a catheter into the vein of a horse to administer fluid therapy while waiting for the Hendra virus test results to come back. This relatively uninvasive procedure by veterinary standards was considered to be unnecessarily invasive in the context of the potential Hendra virus case. Another vet was charged with failing to adequately protect a bobcat driver who was burying a horse. This occurred after the vet had left the property, and this vet was charged despite him having warned the owner that the carcass still posed a potential threat of Hendra virus. The third case related to a veterinarian failing to protect some neighbours of a horse owner when the horse got caught up in a fence the day after the vet had left the premises and before the Hendra virus test result had come back. These prosecutions prompted reconsideration of how the Workplace Health and Safety Act is interpreted in relation to Hendra virus cases, potential Hendra virus cases in horses. Biosecurity considers it the vet and the owners who are responsible for the workplace health and safety. I mentioned earlier that acute illness in horses may be due to other potentially zoonotic diseases. In 2013, I attended 2 horses that died within a week of each other following rapid and severe disease. I took samples that were sent to the state lab for testing for Hendra virus, and both horses came back negative. On further testing that wouldn't normally occur, a diagnosis was reached, and the 2 horses were found to have died from Australian bat lyssavirus. Australian bat lyssavirus could be considered an Australian version of rabies. It's closely related and indistinguishable clinically in horses and humans and other animals. Just earlier that year, tragically, an 8-year-old boy had also succumbed and lost his life as a result of Australian bat lyssavirus. These cases highlight further challenges and the further risks. Equine vets feel caught between a rock and a hard place. My own personal career experiences have highlighted this for me. Early in my career, I saw cases which, in hindsight, should have been tested for Hendra virus, were showing symptoms consistent with Hendra virus, and in one case have subsequently been linked and was likely to have been Hendra virus. But at that time, it was underappreciated the range of symptoms that Hendra virus could present, and testing was not performed. In 2013, with the increased awareness of Hendra virus testing, we found Australian bat lyssavirus, and a diagnosis that probably wouldn't have been reached without that awareness. And in 2017, today, still practicing, despite further experience, perspective, and research, I do not feel that there's increased certainty or less challenges as a veterinarian attending horses that display Hendra-like symptoms. There are risks to the owners and handlers. Health risks. If no vet attends, then the diagnosis is missed. If the condition was zoonotic and could transmit to the people, then there is a risk, of course, that the owners may develop the disease, and some of these diseases are fatal. If no diagnosis occurs in the horse, then there's a severely limited chance in the human health system of reaching a timely diagnosis and potentially receiving that life-saving treatment. There are also high risks to veterinarians, on the other hand, in attending these cases of acutely ill horses when they're unvaccinated and Hendra virus can't be ruled out. Suitable personal protective equipment will not alleviate all of these risks. And in addition to the health risks to the veterinarians, they deal with risks of injury, indemnity, prosecution, financial loss, and others. Prompted by the Australian bat lyssavirus diagnosis, myself and others are pursuing further research into what other potentially zoonotic illnesses might be detected through ill horses. For every 1,200 horses tested for Hendra virus annually, less than 1% are positive. And there's a lack of causative diagnosis, even when there are indications in many of these of infectious cause. Alongside that, those same researchers that detected Hendra virus spillover in, Hendra virus excretion from bats around the country have found novel viruses being excreted from flying foxes, again highlighting the importance of the ecological measures to reduce the risks of virus spillover. Could some of these novel viruses be following the same already proven spillover pathway to horses from fruit bats, and then potentially posing risks to humans? A recent reminder of this potential for novel virus spillover from bats via horses was the 2014 outbreak of a Henipav virus in the Philippines. This virus was very closely related to Hendra virus, but not identical. After spilling over into the horses, it then transmitted between the horses to people and between people. There were 17 human cases with a fatality rate of 82%. There were 15 animal cases, all were fatal. So I'd like to address the charges of the jury with some take-home messages. Despite the advice around personal protective equipment, vaccination, and horse management, we still see insufficient compliance, resulting in life-threatening virus exposures. Several human exposures have necessitated emergency monoclonal antibody treatment, including as recently as 2017, and including of children. Vaccination is considered the single most effective way of reducing the risk of Hendra virus infection, and vets have ethical responsibility to advocate for the preventative health for horses to protect against this deadly disease and for the protection of public. Ecological management around human-bat interaction is important and relevant for a range of bat-borne viruses beyond Hendra virus. We may see a positive effect in time in this reducing virus spillover. It is important, however, to remember that regarding Hendra virus, ecological management should only be considered in addition to the equine vaccination, rather than an effective substitute. I'd like to acknowledge Dr. Peter Reid, Dr. Ina Smith, and Professor Chris Broder for their input into this presentation. Thank you, and I look forward to questions and discussion.